So very briefly, what is the best way to get the third jab, and is it recorded the third jab instead of booster? So this is one big unknown, and frankly, I don't know how things works. I know my patients actually get a text who inform them about going for a booster, and essentially all of my patients, I keep telling them that you should be getting a third primary vaccination and the booster follows 6 months later. So I was told that apparently, once somebody had a booster, the computer cannot be changed. But I'm still writing that in a letter to the GP, hoping that that can be documented. And with pandemic, things changing all the time. So, I wouldn't worry too much. As long as I keep telling patient, well, if you had so-called booster now, put your note in a diary in 6 months' time and make a noise about that proper booster. In 6 months' time. So I think getting booster, it's really important for any patient with hematological condition. If someone does test positive, how do we get access for the Ronapreve? So in the UK, currently, you only can get Ronapreve if someone is unwell enough to be hospitalized. So if you're well and you're at home, you will not get a Ronapreve, not at the moment. Obviously, we're trying to work and see whether that will be available, but currently no. But again, that's what I tell my patients. The pulse oximeter only costs about £8, £10 top. Get yourself pulse oximeter. And I think that's really important, and measure that oxygen level. And if that oxygen level, just have your obviously baseline, but if it's anywhere below 92, call your hospital and get yourself basically admitted if your oxygen saturations are low. So I think it's important to get to hospital sooner. But the vast majority of patients will survive COVID, and will obviously there will be ones who have a very severe COVID. But unfortunately, at the moment, as an outpatient, you can't get a Ronapreve in UK. Molnupiravir, the new antivirals. Molnupiravir, and we've got the Pfizer one, Polvir. Sorry, I still need to get used to those names as well. So that's coming. And as you know, the MHRA sort of approved that ahead of all other health authorities. FDA is not talking till I think the end of November about Molnupiravir. So I'm sure it's coming, and it's been approved in an outpatient setting. So hopefully we will be able to give the patients with mild COVID. Then do you know if there is any progress of I think, it would be really, really amazing if I could give a monoclonal antibody, especially the long acting one, for any of those patients who you have not produced much of the antibody. But at the moment, that's not available. But watch the space, in pandemic, things change very, very quickly.